Thank you very much to Dr. Fred Kruger for joining me today to talk about diabetes and amputations. Doctor, if we can start by talking about what advice do you give your patients who have diabetes? How should they best manage it?
Well, diabetes is a systemic concern. And really, it's a lifestyle more so than a disease. It becomes a disease over time. So what I tell my patients is the most important thing is diet. And if your blood sugars are good, you have a much lower likelihood of running into problems. Specifically concerning the foot, diabetics should not cut their toenails, at least initially. They should not walk barefooted. They need to have proper shoe gear, because what happens with diabetics is as time goes on, there's a loss of sensation, and they may even have painful neuropathy, but they don't have the normal feeling that someone like yourself or myself would have. And so they may have nicked a toe cutting a toenail, and they have no idea that now the toe has been cut, infection arises, they don't feel it, and unfortunately the infection starts to get out of hand when they notice that, oh, something is going on, and at that time you're looking at, emergency room, possible hospital admission, and, God forbid, amputation.
For your patients who do have diabetes, what signs and symptoms should they look out for in regards to their feet?
Well, the community standard of care encourages every diabetic to look at their feet at least once a day. They need to make sure that they don't have any little bumps or bruises, breaks in the skin, anything that has changed over a period of a few days, because that's how the infections start.
Let's talk about the amputation rate here in Fresno County. How severe and bad is it?
It is significant. The amputation rate is pretty much out of control. Whether it's a digital amputation, partial foot, or below the knee, it is significant. And I think part of it is the population base we have. The bottom line again, and it's not just the foot care, it's the diet and the diabetes. Have good blood sugars. Take care of the diabetes. As far as the feet go specifically, look at the feet. Have a family member look at your feet. If you see a change, have access, call the doctor. Get in. If you can do it as an outpatient, it's far better than going to the emergency room.
Those are great tips for our patients out there. Thank you very much to Dr. Fred Kruger.
You're very welcome. Thank you.